My hello and good evening to all of you. I'm Dr. Sachin, Psychiatry Faculty at NAMS. Today I have the pleasure and honor of welcoming with me one another ranker from INICET exam, Dr. Gunjan. He has secured a rank of 137 All India in INICET November 2024 examination. Congratulations too much, Gunjan.
Thank you very much, sir. Thanks a lot.
Thank you for being with us. How are you feeling about this result?
Honestly, after the NEET results, I didn't really start preparing for INICET, but as the counseling got delayed, I thought that, okay, this is my shot for, INICET again in November 2024. So I gave it my all for the preparation, and I really focused on the core topics of INICET right from the start of my preparation. And I think the results say it all.
Great to hear that. Tell us about your journey. When did you actually start preparing for entrance examination?
So, sir, I joined DAMS Academy in my third year of preparation. In third year of preparation, I focused on building my concepts by going to the online or offline classes, and then focusing on the concepts, solving your doubts, uh, being in touch with the faculties, and then solving questions as and when possible. uh, for during that period, sir, my focus was mainly to read the textbooks and the DAM's main notes and supplement it here and there with other sources as and when possible. And when after passing final year, when the internship started, I really pushed myself into the preparation for PG. So the PG preparation differs in the way that you have to be very much avid towards solving MCQs. They say that knowledge is your weapon, but you cannot go to the battle without practicing with your weapon. So, solving MCQs is the practicing that you need to go into the exams. That's what is needed whenever you are preparing for any competitive exam. So that's how I strategized in my internship period, that I solved as many MCQs as possible. And then towards the end of my internship, I joined DVT. So DVT is basically like a concised source for all the subjects that are there, all the previous year topics, all the high yield topics, and all the previous year questions are summed up in a book, which is probably the most high yield source for any exam preparation as far as PG is concerned. And then after going through the DVT, it really raised my confidence. And after that, I uh, really found my pace for for the solving of MCQs and solving the GTs, and that's how I paced myself towards the PG preparation.
All right. So, what was your motivation to start preparing for third PG entrance in the third year itself?
So honestly, it was basically for concept building, because I think that DAMS as an academy has excellent faculty who will not only prepare you for PG preparation, but also give you a strong solid foundation, which will help you in your college lectures, which will help you in your college clinics, and most of all, they will help you in college exams as well. So that was my real motive behind starting my preparation early in third minor, that PG preparation will have a solid foundation, and it will also benefit me in my college exams as well.
So, in third year, did you attend only third and final year subjects classes or all subjects?
Sir, I attended all the subjects wherever possible, whenever I found time. If I missed offline classes because of any issue. So I used to attend online recorded version of that class and make notes by my own. So second year and first year was also covered, and final year and third year was covered as and when the classes were scheduled.
Were you able to finish all 19 in the third year, or did you do some subjects in final year as well?
I did do some subjects, some short subjects, and I think surgery in final year because I couldn't complete it in third minor itself. But probably Uh, I did it deliberately because I thought that surgery was my weak subject and I wanted to do it later on because I wanted it to help my preparation for final year as well.
How do you think a student undergraduate who is listening to you from your own college MBBS or any college in Maharashtra or all over India should balance college studies and professional exam studies with PG entrance studies? How did you balance?
So that's actually really good question because I myself struggled with this a lot. So whenever MBBS is considered, it is actually a heavy course. Let's be very clear with that. You don't really get a lot of time dedicated for your preparation, be it in your third minor or final year or even your internship. But I think I think that you cannot separate your PG preparation altogether from what you are studying in your third minor and final year. So whenever you are studying for your main exams, I think you can consider, you can have it, at the back of your mind that okay, I'm studying this, so how might this be framed as a question? Okay, so this is the case. So, okay, let me just practice the questions and see where I'm lacking. And let me just correct my mistakes right then and there. And during internship, so there are many heavy postings and there are many light postings. जिसका schedule we get at the beginning of the internship itself. So that schedule you can use it to your benefit because you can plan your preparation for the whole year around that schedule. So suppose medicine, as we all know, is a heavy posting in internship. So I did light subjects, cute subjects during medicine posting. During ENT ophthal postings, which are light postings in internship. So I did heavy subjects during that posting. So that's how one should plan their preparation and strategize according to the postings that they are scheduled. So suppose when I was posted in psychiatry, I studied psychiatry during for PG. So whatever I was studying in my room, I was able to see those patients in the wards in the OPD, and then it was kind of a real life revision for me for the subject, and it helped me uh, in my PG preparation. So the drugs that they used to prescribe, the side effects that the patients used to present with, so all that used to become a revision for me during the preparation.
All right. How important it is to make notes during third and final year?
Oh, it is of utmost importance. I mean, the handwritten notes are irreplaceable. They cannot be replaced by anything because when you are making the notes, you are putting basically what your teacher is saying in your own handwriting, in your own words, basically, and that makes it very much easier for you to revise later on. So I think handwritten notes are very important. People shouldn't skip that because I feel that first step of any preparation, suppose is if we take handwritten notes, is like a step of your investment to in your journey of PG preparation. So I think if you invest it very wisely and very meticulously, I think the returns of that investment you will get in your PG exams very well. So I think one should be very consistent and one should be very meticulous with notes making and note down each and every point that is being taught to you.
Okay. So, while revising these notes in internship, you said you revise the notes along with the MCQ practice to use the, that weapons that you mentioned. Okay. And for final revision, you use DVT.
Yes.
So you mentioned that you also cleared NEET PG exam with a rank of around 1600, and then INICET May and then INICET November. What is the difference between these two exams? As an MBBS student, is there any difference in the level of way of preparing for these two exams?
So, the major difference, which is I think known to all, is that INICET will focus a lot on previous year topics, but those topics will be, asked at a lot of depth. You need to be very much well versed with the subject, with the topic that were previously asked. And with respect to NEET, uh, with respect to NEET, the horizon of asking questions, the topics is very wide, but the questions won't be very, very deep. So, but there was an exception in this year's NEET because the questions were a lot in depth. But matlab, we can say that both the exams are, moving towards the USMLE pattern, which has become more and more clinical, less and less fact based, and both the exams are coming closer to each other. This is what I judged from this year's November INI paper and this year's NEET paper. So there is not a great difference, but yes, a few topics here and there will be asked at very, very much depth in INICET.
Can that difference of preparation be done in between NEET and INI, or do you recommend MBBS students to prepare separately for INI to do something else, or at MBBS level it is same?
At MBBS level, sir, I think it is important that you make your foundation so strong that while preparing for NEET or INICET, you don't see a stark difference during the preparation itself. So I won't recommend people to focus on a particular exam right at the start of your preparation. Rather, I would tell them to focus on building your concepts, because what third year and final year students have at their expense is time, which interns do not. So they should if they want, they can really go to the depth of the topics as much as they want and learn that topic as deeply as they want. So I would recommend them not to focus on a particular exam. Yes, you do previous year questions, you do previous year topics very well, but don't focus on a particular exam very rigidly, and focus on a topic and foundation more.
Okay, you mentioned about managing time during internship, that doing a heavy subject in a lighter posting and doing a lighter subject in a heavier posting. So kind of you made your revision schedule yourself during internship.
Yes, sir.
How important is to give test of and grand test, class test, subject wise test during your preparation? How important is the testing system?
So, as I mentioned, the revisions are must. As many revisions as you can do, it will benefit you in your PG game a lot. But as I said, revision will only give you knowledge, and knowledge is your weapon. But GTs and MCQs are the battlefield where you practice with your weapon. So you have to solve GTs. You have to solve MCQs. So the solving of GTs, the frequency can be less at the beginning, probably one or two in a month, but later on as the exam approaches, I think the frequency of one per week is good enough. That worked for me, that solving one GT per week and being able to review it fully was good enough for me to gauge the lacunae of my preparation and to work on those lacunae as and when I found time.
What all resources in eMedico's app did you use any for INICT preparation? You mentioned DVT, you mentioned GP, you saw a few lecture videos. Apart from this, anything PYQ?
Yes, sir. So PYQs for INICT especially are very important because they give you the knowledge of previous year topics. I used to solve TNDs for my weak subjects because I strongly believe that your weak subjects, if you really work on them, they give you the confidence to face the exam with a better temperament. Because what happens, especially for pharmac, what used to happen was that INICT used to ask a lot of deep questions in pharmacology very randomly. So I worked really hard on pharmac, solved a lot of MCQs, solved a lot of TNDs, made modifications in my DVT, so that at the last minute revision it will help me revise those topics better. So because of this, what used to happen is that even if a difficult pharma question is there, i would I would approach it with the right attitude, so that at least I could reach the answer by eliminating the wrong options, so that I might not leave the question altogether, which I used to do at the start of my preparation. So I think TNDs is a really good source apart from all the other sources mentioned, that I feel will really help you, especially for your weak subjects.
All right, all right. So TND you used PYQs, DVT, and main lecture videos. Okay. Any specific person or teacher or your friend or family member that comes to your mind you would like to mention today because you have achieved greater heights today?
Sir, I mean, I would really like to thank all the faculty that have helped me throughout the process of my PG preparation, especially you, because I attended your offline lecture in Mumbai. So I remember that you used to enact patients while teaching psych, and that was like seeing a real patient who is behaving and giving us a real life complaints in front of us, and we are able to diagnose that patient. And that type of question was going to be asked in the exams as well. So that really helped us connect, more with the subject. I would also like to mention Dr. Dipti ma'am, whose personal connect I liked a lot during her lectures. So and also I would like to thank my friends who were very supportive, who used to guide me wherever I was going wrong, my seniors who have achieved great ranks in the previous examinations. I'm very thankful to them for their guidance. And last but not the least, my parents, who were supportive all throughout the preparation, and they really helped boost my morale throughout the preparation.
Thank you so much, Gunjan. And before we finally close up this interview, any final advice that you would like to give to your friends who are giving the next exam of NEET or INI, or any junior advice to your junior from your side, Ram?
So after watching this interview, I would like to tell all my juniors that even if you find my strategies useful, don't blindly follow them. Even if you find anyone's strategies useful, don't blindly follow them. The goal might be the same, the rank might be the same, but everyone's journey towards the rank, towards the destination is different. So listen to everyone's advice and take the points that you find fit, that you find which are useful for you, and then only you personalize your preparation according to what you think is the most useful way for you. There will be good days for in your preparation, there will be bad days in your preparation. So don't lose your morale during your bad days. Try to make your good days even better, and don't let your bad day be worse. So that I would really urge you to maintain a consistent level of your preparation throughout your journey, and I would really wish you all the best, and would really like to see some great rankers from DAMS the next in the next exams.
Thank you so much, Gunjan. Thank you for being with us. It was a pleasure talking to you. Wish you all the best for your future endeavors as well. Thank you.
Thank you very much, sir. The pleasure is all mine. Thank you.